Hi, everyone. I'm excited to share the Kaiser Permanente KP Cares Care Experience training for the Riverside service area. This initiative focuses on enhancing how we connect with our patients, colleagues, and community by reinforcing the principles of empathy, respect, and compassionate communication. Together, we're creating a culture where every interaction truly reflects the care experience that Kaiser Permanente stands for. At Kaiser Permanente, we want our employees to be at their best. In partnership with labor, existing standards were combined, now known as KP Cares. These standards were designed around our core values and describe our expectations and the commitment to an exceptional care experience. During today's session, you will learn about the new KP Cares Experience standards, rediscover and review how to apply ADET and AHART models into practice, as well as the importance of your role in the care experience. The agenda will connect you to the why, the how, connection, and your personal ownership in care experience for all members. At Kaiser Permanente, our why is our members, and we live by our mission and vision. When you are part of an organization, you should make sure your personal mission aligns with the mission of the organization you are a part of. Here's a message from our senior leaders, Dr. Ramin Davidoff and Michelle Gaskell-Hames.
Hi, I'm Michelle Gaskell-Hames, President of Kaiser Foundation Health Plan and Hospitals for Southern California and Hawaii markets.
Hi, I'm Ramin Davidoff, Executive Medical Director for the Southern California Permanente Medical Group and Chair of the Board of Directors for SCPMG, Hawaii Permanente Medical Group, and the Southeast Permanente Medical Group.
The people at KP are at the center of exceptional experiences we provide to our members and to our patients. At Kaiser Permanente, we create caring moments with safe, personalized, and exceptional experiences for patients, their families, and each other, because every moment matters. In today's competitive market, our members expect and they deserve the very best at every touch point. We know as consumers ourselves that ratings matter, interactions matter, and when an organization gives us a great experience, we are more loyal to that organization. We in healthcare can't ignore this fact.
That's right, Michelle. When members experience our high-quality, coordinated care, and when they feel listened to and respected, they stay with Kaiser Permanente. And these highly satisfied members tend to be very engaged with their own health. We know that better engagement means better outcomes. So providing an exceptional experience is a win-win for us and our patients. We also know that highly satisfied members become advocates for Kaiser Permanente and recommend us to their family and friends. And we know that an endorsement from someone we trust is so very important when it comes to how we make healthcare decisions.
That's right, Ramin. Today, you will be learning about our Kaiser Permanente Southern California Care Experience Standards. These standards are at the core of our mission to provide high-quality, affordable healthcare services and to improve the health of the communities we serve. As an organization that puts our members and patients at the center of everything we do, we need to provide you with the training and support you need to be successful in carrying out that mission. We at KP are committed to caring for our people so that you can care for our members and our patients.
Providing an exceptional experience every time for every patient is essential. And this goes beyond our clinical care. It includes every interaction. This program is designed to help you feel empowered and supported to create an exceptional experience at every member and patient touchpoint. We hope you will be inspired by today's session and that you will share the essential tools and best practices with your colleagues. Thank you.
We are happy to support you every step of the way. Thank you.
Care experience is the sum of all interactions shaped by an organization's culture that influence perceptions across the continuum of care. Regardless of where your work lies within the organization, you are a critical piece to the healthcare journey of our members and patients. As one KP, we rely on the promise of care coordination to ensure continuity of care and the highest service at every touchpoint to create a lasting impression, whether a patient or a member is receiving care from our hospital, urgent care, doctor's office, clinic, or in their own home. How do people make healthcare coverage decisions? A. Cost. B. Experience. C. Service and access. D. Social media ratings. E. All of the above. The answer is E. All of the above. What drives healthcare decision making? There are various factors which impact an individual's healthcare decisions. But the most prominent factors are connected to cost, their experience related to service and access of care, as well as competition and social media ratings.
So, several years back, my son Luke called me at 10 o'clock at night. And if you know anything about boys in college, they don't call their dads unless there's something wrong. And so he calls me at 10 o'clock at night, and I answer the phone, and he said, "Dad, I'm okay, but I'm in the Kaiser emergency room in Santa Rosa." And I said, "Okay." And he said, "John hurt himself in a skateboard accident, but he doesn't have Kaiser. I'm wondering if you could do something for him so he could get treatment." So I told him, "No, I can't, but leave him there. They will take care of him, and call me back when you're settled." He called me back a little bit later, and I asked him what had happened. And they had been skateboarding down a hill at dusk, and right where you reach the greatest speed, there were these metal covers on the road, and the skateboard hit the metal cover, and John went flying and dislocated his shoulder. So let me provide you context. He's 19 years old. The car that they're driving was John's car, not his car. He sees his friend's shoulder popping out. And I asked him, I said, "Luke, you passed 4 other emergency rooms to take him to Kaiser Permanente. Why did you not take him to the closest emergency room?" And he said, "Well," again, friend's shoulder's sticking out, he's screaming in pain. He goes, "I yelped emergency departments, and Kaiser Permanente in Santa Rosa was the highest rated one, so that's where I brought him." I think that this is telling, and as I reflected on that more and more, the way our customers interact and use and evaluate us has less to do with some of the national measures that we look at to rate our quality, and more to do with perceptions of care through social media. And I thought that that was a great learning.
Our patients can leave feedback about their experiences on different media platforms. Newer generations increasingly rely on social media for healthcare information. Our organization must be mindful of how our interactions impact our reputation. Think about your parents and what generation they fall into. Do they use social media to review ratings? Do they do research before a doctor's visit? Think about yourself, your children, your grandchildren. Think of the differences in how they approach consumerism. Power of social media. Gen Z is twice as likely to go to social media for medical information. 51% of millennials research the quality or rating of a healthcare provider versus 34% of Gen Zers and 31% of baby boomers. Greater than 75% of millennials trust online reviews as much as personal recommendations from friends. In the age where everyone is connected to information at their fingertips, member feedback is easily accessible. Apps such as TikTok, Instagram, Yelp, for example, oftentimes showcase member reviews or experiences in the form of comments or even videos and pictures. Based on the Google algorithm, can anyone guess how many stars we need to have to show up as an option to consumers? It's 4.3 stars. Per a survey conducted by Reputation.com, 86% of patients say they read online reviews, with 60% reading at least 5 reviews for researching of healthcare providers. When we look at the percentage of comments related to experience standards, 60% are tied to experience, whereas 33% is connected to access and weight, and 7% are connected to clinical treatment and outcomes. The quality of care and service provided to our members is a main source of information to aiding in why members choose us for their care or leave for other organizations. Medicare uses the STAR rating system to measure how well Medicare Advantage and Part D plans perform. Ratings range from 1 to 5 star, with 5 being the highest. What is the issue? For the first time in 12 years, Kaiser Permanente dropped from 5-star to 4-star rating in 2024. We are now at a 4.5-star rating. Why is this important? Going from a 5-star to a 4-star means a loss of year-round enrollment, a significant reduction in payment from CMS, and a profound impact to our reputation as a premier Medicare provider. What is driving this change? Recent scoring changes in care coordination section are our greatest opportunity for improvement. Getting test results as soon as needed and doctor's office followed up on test results. What percentage of feedback received in our internal surveys is positive? Greater than 85%. Over 85% of our members provide us with positive feedback. For real-time feedback, 87.4%, percents 9s and 10s, are from over 350,000 survey returns from program inception. Members who leave us. These groups displayed here leave us at rates disproportionate to their membership. Why do we think millennials leave KP? For an internal KP study, it was revealed that young millennials cite friction of accessing outpatient services such as gyno, peds, derms, etc. For young adults, oftentimes we see they are aging off their parents' coverage. College students move out of state and are no longer in the service area. New families seek pediatric care elsewhere. And seniors are aging into Medicare. What matters most to members and patients? Easy and convenient care, such as care when I want, how I want, and where I want, and personal connections. Staff and physicians showing care and concern, empathy, active listening, and partnership with my care team are what matters most to members and patients. For why members select KP, we oftentimes hear that our services are integrated / one-stop shop, and that we provide quality care and have great providers. While not listed on this slide, I did want to call out that Kaiser Permanente is sometimes listed as a lower cost option by members' employers, and is another reason for why members select us. As to why members leave KP, we know that 36% of SCL terminated members surveyed left KP voluntarily despite having the opportunity to remain with KP, while 64% no longer had KP as an option. Other reasons members may leave Kaiser Permanente are due to issues with their medical care experience or access. We have learned about the why we exist, and do what we do. Let's talk about how we do that. KP Cares Experience Standards. KP. Kindness and personal integrity. I am positive, helpful, and hold myself accountable to ensure that everyone has an exceptional experience. I am committed to doing the right thing and taking ownership of my work. C. Communication with empathy. I build trust and confidence by using clear communication. I show warmth, empathy, and respect in every interaction using the ADET model. A. Appearance and environment. I build trust and confidence in the KP brand by taking pride in my appearance and environment. R. Responsiveness. I am responsive to patient and member needs. I demonstrate a caring connection when communicating with others via telephone or email. E. Excellence in teamwork. I treat my team as valued partners by promoting a respectful and positive culture. S. Service recovery. If the experience falls short, I take personal responsibility to make things better by using the AHEART model. We will discuss each component of KP Care's experience standards more in depth, beginning with KP, kindness, and personal integrity. KP, kindness and personal integrity. How I demonstrate kindness. I come to work ready to provide the best work environment for my team, members, patients, and caregivers. I understand that my behavior and attitude have an impact on others. I am aware of my body language and tone of voice to ensure that I come across as professional, courteous, and respectful. I welcome constructive feedback on how I can improve. I treat everyone equitably and respect cultural differences. I look for opportunities to wow patients and members, showing an extra special level of service whenever I can. This is an employee video sharing how they make connections and show kindness in their roles.
My name is Alexander Mendoza. I'm from Corona, California, but I work in the Irvine Medical Center off of Sand Canyon, and I am EVS housekeeper currently.
My name is Stephanie Galvan. I work at Kaiser Permanente Baldwin Park in the critical care unit as a registered nurse.
There have been a couple patients I've noticed, like from their clothes when I clean their room, they have like a motorcycle logo on it, like a Harley Davidson symbol, and that's my avenue to spark a conversation. He was from out of state when things went south, and so his family wasn't able to see him for a couple of weeks. He had no interaction with his family. The only conversations were just with nurses, and it was near my break time when I entered his room, and we just had a conversation for 30 minutes. Oh, do you ride motorcycles? How long have you ridden? Having a conversation that completely breaks them from that mindset of being a patient and just a normal human interaction. For that 30 minutes, he wasn't freaking out about, oh, I'm stuck in a hospital in Southern California. My family's, a couple hours by plane away.
My patient, she had just had a baby, given birth, and she went home and she just started bleeding and it wasn't stopping. So when she came in, her hemoglobin was low. She came into the critical care unit. She said it's a traumatic experience because she felt her life leaving her body. And all she could think of was her husband and her newborn baby and her 2-year-old.
It was really rewarding just to make someone feel better emotionally. The following days when I would go and visit that patient, they always had a bright smile on their face. It made my day.
She knew that she can trust me, her and her husband. I even told the husband, you can go home. I will take care of her. And if anything happens, I'll make sure to call you.
In this, storm cloud, you show them a little bit of sunshine, you show genuine care and empathy, and it carries. It carries quite a long distance.
Dear Stephanie, thank you for taking exceptional care of my wife. You have helped to make this traumatic experience more bearable for us both. You have gone above and beyond the call of duty and made her feel comfortable. We deeply appreciate your expertise, compassion, and sense of humor. You are a rock star. With love and appreciation. It makes all the hard days that I have worthwhile because, we may not always get a thank you, but when we do, we appreciate it, and I hold it close to home. Nursing, you still have to have some love, some compassion, and empathy, and that's what every patient wants to feel when they're with us, when they're in our hands.
KP Care's experience standards. C. Communication with empathy. First impressions. I use the ADAT plus empathy model. Acknowledge, introduce, duration, explanation, and thank the member. I give an immediate greeting and warm acknowledgement. I am friendly, smile, and make eye contact. I identify myself, my department, and services offered. I ask at least one personal question to build my connection. I respect and honor preferences by only communicating in their preferred language. I approach others and do not yell names from afar, example, in the waiting room. I use please and thank you and proper names/pronouns throughout my interactions. Active listening. Listening with the intent to understand how the other person is feeling and putting yourself in their shoes. Active listening can help build empathy. Here are some tips on how to do it. Try to understand the feelings attached to the message you're hearing. Don't interrupt by sharing your own story, by commiserating, or immediately trying to problem solve. Give nonverbal cues, eye contact, nodding, and verbal feedback that confirms your understanding. When you give feedback, check your understanding by repeating in your own words, "What I'm hearing you say is." The ADET communication framework should be a refresher for you. As part of our expectations here at KP, everyone should be incorporating this framework into their day-to-day interactions. As a reminder, ADET is an evidence-based model for effective communication and is widely used throughout the healthcare industry. These are mandatory behaviors as an employee for Kaiser Permanente to ensure our members and patients have a great experience from the moment they enter our organization. I acknowledge. I introduce. Duration. If pushback received on duration, provide recommended solutions around under-promising, but over-delivering. Example, provide a time frame to member in which you will return to share an update regarding their care, how long the procedure may take, or how long the member's wait time will be. Explanation. Thank you. Using ADAT helps decrease anxiety and increase compliance by patients because it helps the patient feel welcome, valued, and understand what the caregiver is doing to help them. Trust builds compliance to care plan, which builds better health outcomes. Based on a study completed by Huron Consulting Group, organizations who implemented and practiced ADAT in the workplace successfully saw significant improvement in all of the HCHPS domain questions, inclusive of provider and nurse communication. We just went over ADAT, and the model is ADAT plus empathy. So let's watch a quick story on empathy in action. Here's a review of some keywords among the empathy and compassion spectrum that are often used interchangeably in society. However, they each have distinct meanings, and it is essential for us as healthcare workers to understand the differences. Pity, I'm sorry for you, and sympathy, I feel for you, may require little to no effort or understanding, but empathy and compassion demand our active engagement to understand and make a positive difference. Empathy, I feel with you, the ability to understand and share the feelings of another. Example, this is the first time this patient is taking these medications. I imagine they are worried about their new diagnosis and how these medications may impact them. Compassion, I'm moved by you, taking action to acknowledge the understanding of another's feelings and experience. Example, since I see this patient's worry and I care, empathy, I will sit with this patient to explain their medications and side effects, answer all their questions, and let them know that we are here every step of the way. For example, I imagine you might be concerned about taking these new medications. Let me review what you can expect and any possible side effects. We've reviewed a lot of information. What questions do you have? Compassion is about taking action in response to empathy. Empathetic statements. Reflecting, I can see that you are. Legitimizing, it's understandable why you feel. Supporting, I want to help. Partnering. Let's work together too. Respecting. That must have been difficult to experience. Complimenting. You should be proud of the improvements that you have made. KP Cares Experience Standards. A. Appearance and environment. Appearance. I understand that my appearance is a representation of my professionalism and of the KP brand. I follow all departmental and human resources dress code policies. I dress appropriately and conduct myself professionally. My clothes or uniforms reflect the image of the KP brand and my profession. I wear my name badge at chest height for patient visibility. Fingernails must be kept neat and clean and in compliance with the hand hygiene policy. To protect patients and coworkers with allergic and respiratory sensitivities, I do not wear harsh fragrances. KP Cares Experience Standards are responsiveness, telephone and email etiquette. I prepare by reviewing essential information prior to calling a patient or team member. I return telephone calls or emails in a timely manner. I follow through on any commitments and look for concerns. I prepare by reviewing essential information prior to calling a patient or team member. I ask if they have any questions and set expectations. Telephone. I use courteous language and a warm, friendly tone. I identify myself, my role, and my department. I verify that I am speaking to the correct person. I explain the purpose of the call and avoid background distractions. KP Cares Experience Standards. E. Excellence in teamwork. In my department, I speak positively to build trust and confidence about my team. I participate in creating a welcoming, supportive, and inclusive environment in my department. I am a resource to my team, offering help, guidance, and ideas for improvement. I anticipate needs to ensure smooth operations. I speak up and make suggestions when something is not working. I encourage and celebrate self-expression and model authenticity that builds trust, safety, and a sense of belonging for all. KP Cares Experience Standards. S. Service Recovery. Service recovery with a heart. I understand if the experience falls short and expectations are not met, I will apologize and do what I can to exceed expectations. I will own it. I will use the AHEART model to apologize and de-escalate if necessary. Apologize for the experience. Hear the person. Empathize with their feelings. Ask how you can make it better. Resolve the concern. Thank the person. I will not blame others or the organization. I will use active listening to others without making excuses or being defensive. I will acknowledge mistakes and be truthful. Satisfied customers never even tell the company. 17%? 44%? 73%? 96%? The answer is 96%. Why is service recovery so important? 96% of customers don't tell us they are unhappy. 91% of unhappy customers will tell at least 9 other people. 82 to 95% of customers complain, return if they are impressed with the company's response. Service recovery with AHEART refresher. Apologize for the experience. Check your reaction. Start with, I am sorry. Hear the person. Let the person tell you what they want to say. Listen to the person's core perceptions, concerns, and feelings. E. Empathize with their feelings. Use words or phrases that demonstrate caring and understanding. Use body language and tone of voice that mirror your empathetic statements. A. Ask how you can make it better. Re-apologize for the concern. Ask, what can I do to make it better? R. Resolve the concern. Use the requested solution if possible. Provide additional options as needed so the person knows all possible solutions. T. Thank the person. Start with thank you for. Appreciate the effort it took for them to express the concern. If service does not meet expectations, it is our personal responsibility to make it right and meet the member's needs. Service recovery is the responsive action taken to reestablish a trusting relationship. Service recovery paradox is a very strong positive service recovery that leads to stronger customer loyalty. When we do service recovery well, within a timely manner, customers tend to be more loyal to the company. Hard tips. Resolve issues at point of service. Apologize, empathize, and listen. Be patient and respectful of culture and language differences. Utilize your region's language assistance resources. Focus on the issue or behavior, not the person. Don't blame others. Avoid using "no, it's our policy" or "short-staffed." Listen carefully. Most people usually recognize your job role and may not have unreasonable expectations. Speak up, listen up, and follow up. Even if the issue is not your fault, it becomes your responsibility to resolve once it's brought to your attention. Safety is very important to us. We do not allow any of our employees to be mistreated. When you identify that a patient is becoming escalated in their behavior, take steps immediately to de-escalate the situation and, if needed, call for help and move to safety. How do we de-escalate the situation? Create calmness. It's never about you. Avoid taking it personal and getting defensive. Identify your triggers and how to manage them. Focus on your tone not matching the member's tone. Allow time to bring calm. Positively lead conversation forward. Use supportive words. Try to find a solution. Manage expectations through communication. Bring focus back to working together. After encounter reflection. Take a moment for yourself. Debrief with colleague/manager to provide support. Our Kaiser Permanente members also have behavior expectations known as the Member-Patient Visitor Code of Conduct. We're committed to providing a safe, secure, and respectful environment for all. We expect all individuals to demonstrate civil and respectful behavior while on premises or in virtual or home health care interactions. We have taken some time to learn about the elements of KP Care's experience standards. As we navigate towards the end of the training, we will utilize the opportunity to put this in practice as well. Remember, if it's important for our members, it's a commitment for Kaiser Permanente. Follow the KP Cares for every interaction. Ask and listen to what matters most. Personalize the experience when possible. Utilize ADET plus empathy. Utilize a heart for service recovery. Always provide seamless transitions. Use positive language instead of negative language. Example, "It's not my job" versus "Thank you for letting me know. I'm going to find someone who can help you." KP Cares encompasses all of us who represent Kaiser Permanente. We talked about ADET and AHEART, and our physician and inpatient colleagues have similar communication models. It takes all of us to create an exceptional experience for our members. The 4 habits, physicians and advanced practice providers, a standardized practice for physicians and advanced practice providers to create a welcoming environment and space as they are providing care to members. The Connection Bundle Workflow, a standardized practice that originated in Southern California KP that helps our clinical teams create personal connections with our patients. Inpatient staff may use this model to establish a welcoming environment, cultivate trust and confidence to reduce anxiety, promote comfort and respect, which can lead to improved care experience. The member, patient, visitor code of conduct, a commitment to provide safe, secure, and respectful environment for all. This is an expectation for all individuals to demonstrate civil and respectful behavior while on our premises or in virtual or home healthcare interactions. Before we end, I wanted to close out with a quote from Gene Watson: "The patient experience begins and ends with compassion." Thank you for joining me today. I hope this presentation inspired you to embrace the KP Cares principles in every interaction. Together, we can continue building a culture of care that reflects the heart of Kaiser Permanente.